As we dive into pathophysiology, we're going to look into the introduction to human disease, and this particular chapter is really going to focus in on a lot of terminology. So some terms that we need to look at and know, one of the main terms is homeostasis. Homeostasis is a state of normalcy. Okay? It is our body's state of trying to keep things equal, the same, unchanged. Okay? And this is in our bodies, at least, it's a self-regulating and it's a give and take type of system. We have two kind of ways to look at homeostasis on how we try to maintain it and return our body back to homeostasis. These are known as negative feedbacks or positive feedbacks. Negative feedbacks are very similar to what we see in your house, like with your thermostat. You set your thermostat at a certain temperature. Let's just say it's set at 70 degrees. When it gets above 70 degrees, your air conditioner kicks on and brings it back down. When it goes below 70 degrees, your heater kicks on and brings it back up because 70 is where it has been set. We have a lot of these negative feedbacks in our body. Examples are temperature as well. When you get too hot, you're going to sweat in order to help cool your body down. And your skin also starts to get red because the blood goes to the skin and helps get the heat out. On the other hand, when you get too cold, then you shiver. Okay, all the blood starts to drain towards your internal organs, so your skin becomes pale. All right, because you can technically live without these guys. You can live without this, your nose. You can live without your external part of your ears. You can live without your toes. You may not want to, but you can. All right, but we can't live without our heart and our liver if those were to get too cold. All right, so homeostasis is maintaining that example body temperature. We also have one like for blood sugar. Your blood sugar is supposed to stay at a certain level. If it gets too high, hormones get released to help bring it back down. If it gets too low, other hormones are released to help bring it back up. Okay, so there's a lot of different things that go on to help keep that homeostasis. And most of the feedback mechanisms in your body are negative feedbacks. Some are positive feedbacks. With positive feedback, it means that it's going to get worse before it gets better. Bleeding is an example of this. When we have damage to a blood vessel, we actually see an increase of blood flow to that area. The reason being is the blood has the clotting factors. It's going to help be able to plug that hole up. So it's going to normally get a little bit worse before we can plug it up and make it better. All right, we see women tend to have a lot more of those positive feedbacks too. Their monthly cycle is an example of that. Childbirth. Okay, contractions start, they get worse and worse and worse till the baby's born. Then they start to go back the other way until it gets back to normal. All right, breastfeeding is the same way. So most of the body's attempts at keeping homeostasis are going to be considered negative feedbacks. Very few are what we would look at positive feedbacks, but there are some. Another term we need to look at when we're looking at pathophysiology is disease. Disease is when there's a change from that normal. Okay, so homeostasis may have gotten out of whack in some way. This is where symptoms occur with a pathologic state present. Okay, so when we look at this, it means there's like a reason behind it. Something is not working like it is supposed to. And how the body tries to put it back may be indications of some of those symptoms or those signs so that we can figure out what is wrong with the individual. Now, a disorder is closely related to disease. A lot of times they're looked at as the kind of the same thing, but disease and disorder are different. Disorder is an abnormality of function. Something is not working right. So when we look at this, it's the body or the mind is not functioning correctly. There could be like a nutritional disorder. This disorder of your nutrition being out of whack is causing issues in other areas of your body. Okay, we see this a lot of times, like if you're not getting enough calcium, then your bones start to get weaker. All right, and so we see that that is what we would consider more of a disorder. We also have syndromes. Syndromes are when symptoms are caused by specific diseases. Now, a lot of times with syndromes, there could be interrelated types of problems that are present. So when we look at something like Down syndrome, we see that there's a lot of different things that are present or symptom-wise that are happening in that individual because they have an extra chromosome. All right, so we might see that they have blood issues, they have heart conditions, kidney problems, all cognitive issues, all because of one issue of having a extra chromosome. Okay, so a syndrome is kind of interrelated types of problems. Another term we want to look at is pathology. Now, pathology is the study of a disease. That's when we look at pathophysiology, we're looking at the study of the disease, but also how that disease progresses. Hey, what is its kind of normal pattern is it going to go through? What kind of treatments are we going to give if there's certain symptoms that are present? So when we look at pathophysiology, we're not just looking at the study of the disease, but also the progression and the outcome of that disease. Pathologists are people who study disease. Now, there's a lot of different pathologists out there. Okay, pathology can be broken down into a number of different areas, and you can see that here in this particular little chart. We see that there can be experimental pathologists. Those are going to do more research. Some academic pathologists are going to be doing more teaching. We can see surgical pathologists are the ones where biopsies get taken, like during surgery, and they're going to check to see if cancer is present or if problems are there. We also see with microbiology, they are also a type of pathologist, but we're looking more at the microorganisms. So viruses, bacteria mostly, as well as things like fungus or even certain protists. Now, when we look at this, pathogens are microorganisms or agents that are going to cause the disease. And this is where a microbiologist comes in handy a lot of times here, is if it is caused by a bacterial infection or a viral infection. So pathogens are the things that are potentially causing the illness or disease. If something is pathologic, it's caused by the disease process. Example of this is some individuals can have pathologic fractures. This is where the bones break because of the disease that is present. Okay, so something like osteoporosis, the disease disorder is present, the bones are becoming weaker, but the break is actually due to that disease that's present. So that's considered a pathologic break. Okay, it's not just that they fell down and it was a trauma that caused the bone to break. We also see pathogenesis. This is a description of how a particular disease progresses, how it goes through its normal processes. Now, when we look at pathogenesis, we can put diseases into kind of two groups. One is acute. Acute is short term. Okay, this onset is normally pretty quick, it's fast, and it's short term. Now, when I say short term, it doesn't mean like 24 hours or just a couple hours. It could be several weeks, but it does resolve itself relatively quickly. On the other side, chronic pathogenesis is long term. A lot of times this is a really slow healing process, and it might be something that the patient deals with lifelong when we look at a chronic type of disorder or pathogenesis. So this brings us to what we would consider idology. Okay, so idology is the actual cause of the disease, and there's a lot of different things that could actually be what we would consider idological agents, or things that actually cause or we can contribute to that disease. In some cases, it's biological. If it's a biological cause, this could be due to bacteria. It could be due to viruses. It could be a type of fungus that's present. There could even be a worm infection when we talk about helminths, okay, a type of worm infection, or even some of our parasites like we would consider protists. Those would all be biological types of agents. On the other hand, there could be chemical agents. Chemical agents could be things like drugs, alcohol, even medications, whether they're over-the-counter medications, prescription medications, it could be that chemical agent. There could be some physical agents that are causing the disease. Physical agents are going to be things like trauma, like a motor vehicle accident. Okay, so that would be trauma that's present. It could also be a burn. Okay, when we see burns that take place. Another one is the nutritional excesses or deficits. You either have too much of something nutritionally or not enough. One example could be like vitamin C. If you're deficient in vitamin C, a lot of times it makes your immune system a little bit weaker. Vitamin K, if you're deficient in vitamin K, your blood doesn't clot properly. All right, so we can see that certain kind of nutritional factors could ultimately affect something else in our body. Some other terms that kind of come along with the cause of disease. The first one here is idiopathic. If it's an idiopathic disease, the cause is unknown so far. A lot of times when a patient comes in, you're looking at it first as being idiopathic. We don't know what's necessarily causing it. We have to undergo certain tests, certain procedures to try to figure out what is causing the problem. Another one is what we call iatrogenic. Iatrogenic types of diseases are where the problem comes from the treatment. we are treating for something and it causes another issue to arise. An example of this might be where we're treating for a viral infection and they develop a secondary bacterial infection, or they had a heart transplant, and because we don't want their body to reject the heart that they just got, we suppress their immune system. But because we're suppressing their immune system, they're more prone to getting different types of infections. All right, so it could be related to how we treated something else that causes another problem. Now, this isn't caused on purpose. We're not trying to make them sicker. It's just something that can occur. A lot of times we would call these types of complications due to treatments. Another one is the nosocomial. Nosocomial types of diseases are diseases acquired from hospital-like environments. So these are going to be where they get that particular disease or illness while they were in the hospital. So you went in for a surgery, so let's just say like a total knee replacement, but then you get a staph infection. That staph infection you got in the hospital, it was from something that happened at the hospital, so that would be what we called a nosocomial type of disease. All right, so these are putting them into kind of categories for what is causing them. Now, there are some things that predispose us to certain diseases. Okay, these are also known as risk factors. Predisposing factors are known as risk factors. This makes you more susceptible to something, and age is one of them. Okay, we see that the very young and the very old are more susceptible to diseases. The younger are susceptible because their immune system is just now starting and it's building. On the other hand, if they're very old, their immune system is tired and it's not working like it should anymore. We also see sex. We see that different hormone levels in males and females actually can cause you to have a higher risk factor for certain types of diseases. One specifically is cholesterol. We see that women who have their normal levels of estrogen tend to have more control over their cholesterol levels, okay, than men do. You don't normally see women with high cholesterol until after menopause, when the hormone of estrogen is not being produced as much. Another one is environment. There's a lot of environmental factors that could put you at risk. These could include things like the amount of pollution where you live or where you have visited. Sanitation practices, whether they're poor or good sanitation practices. Whether you're under stress from your job or just life in general. Okay, we also see there could be lifestyle factors. This could be, do you smoke? Okay, another one, do you have good nutrition? Okay, or do you rely on junk food? Do you drink? Do you exercise properly? Now, guys, when we're looking at environmental and lifestyle risk factors, a lot of those can actually be modified. We can change them. Okay? We can quit smoking. We can start exercising more. We can work on our nutrition. Okay, we could move out of the area where there's a lot of pollution potentially. So modifiable risk factors are going to be found normally in the environment and the lifestyle side. Guys, you can't modify your age, and really you can't modify much about your sex, even though we have those changes with like transgender and things like that, where they are modifying the outward appearances. There are still genetically going to be factors that make them male or female that could put them at higher risk for things. We also see heredity. When we look at your heredity, that's your genetic makeup. Your genetic makeup may predispose you. This is why when you go to the doctor, a lot of times you have to fill out the forms for like medical history. And they want to know how many individuals in your immediate family have had cancer, or how many suffer from high blood pressure, how many of them have had endometriosis. Okay, they may want you to give some of that because there could be a family history, which means you might be more prone. Doesn't mean you definitely will get it or deal with that problem, but you might be at a higher risk. Now, one of the modifiable things that can help us a lot of times with disease is washing your hands. All right, and this really right now is kind of like beating a dead horse, but guys, we need to know how to wash our hands, and we need to know how to wash them properly. All right, so there's a health highlight when we look in your textbook that talks about this. Guys, when you wash your hands, make sure that you do wet your hands, and it doesn't have to be warm water or hot water. It can be cold water as long as it's running water. That's the key, the running water. Okay, then you can apply your soap. Okay, now it talks about here that you can turn off the tap or you could leave it running. When you turn off the tap, it could cause some more contamination based on who's touched it before, but it doesn't matter so much there as long as you are then lathering your hands with the soap. And when we're talking about this, when we're lathering our hands with the soap, we need to make sure that we get in between our fingers. Okay, so when we get in between your fingers, you want to make sure you get your thumb. A lot of times we forget about that. Okay, get in between your thumb. You should also then kind of work and get between underneath your fingernails. You can do that just really kind of quickly as you go through that. Make sure you get the back of your hands real well as the palms of your hand. Okay, and you should do this for at least 20 seconds. Okay, doesn't mean you have to set a timer beforehand, but a key thing is you could potentially in your head sing happy birthday through twice. That's 20 seconds. You could also find out 20 seconds of your favorite kind of song or saying that you might say over and over to help with that. Then you need to rinse your hands. Again, rinsing them with clean running water. Then dry your hands using a clean towel, or you could air dry them. Now guys, one thing that's important here though too is if you will make sure that you have the paper towel ready, and a lot of them, you know, they have the part where you can wave and they have motion sensors. Take the paper towel, dry your hands, and then use the paper towel to shut off the water. Also, use the paper towel to open the door, especially if the bathroom door, public door, has a pool that's there. You can use that paper towel before you throw it away. This helps prevent your hands from getting contaminated right after you washed them. So what are some standard precautions when we talk about the whole idea of like staying safe and trying to help prevent diseases? Okay, when we look at the CDC, hand washing is the top one. Okay, the next one is respiratory etiquette. And guys, when we look at respiratory etiquette, this is covering your mouth, nose, or both with a tissue when you're coughing or sneezing and disposing of that tissue properly. Okay, so when we look at this is where we want to cover our mouth. Now, sometimes we don't have tissue, and used to, we would tell people to cover their mouth here. We don't do that because we want to make sure that we don't necessarily contaminate our hands. And we talk about using your elbow or your sleeve. Okay, using that. You may be asked to wear a mask, especially when you go into a hospital. If you have a potential respiratory issue, they might ask you to wear a mask while you're in there. All right, and so masks might be part of that. Maintaining distance from others, ideally about 3 feet. Wash your hands. Now, guys, this is if you were sick. If you know that you have a runny nose or a cough or a sneeze that's present, you don't go get in everybody's business. You don't get in their face and their space. Okay, you give distance because you might be contagious and you didn't necessarily know that. All right, and so this is what we talk about with respiratory etiquette. Another one might be wearing gloves. We wear gloves when touching blood, body fluids, or contaminated items. And we need to change gloves after the patient contact so we don't contaminate other things. We should wash our hands before we put gloves on and wash our hands after. Now guys, this is of course more for the medical field. I'm not saying you need to carry gloves around in like your purse or backpack or whatever, okay, and you need to use those. But if you are going to be administering first aid to somebody, gloves are a way of protection. Okay, protecting if blood is present or bodily fluids are present. We don't always have access to them, but if they're available, you should use them. Okay, and again, if you're working in that medical field, you wash your hands before you put the gloves on and you wash them after. Another thing would be wearing eye protection. Okay, whether this is going to be like a type of mask or face shield. This is to reduce the risk of splashing or spraying blood or body secretions into your face. This is one reason why we see that surgeons will wear these things to help protect them. A gown, this is a waterproof type gown, again to help prevent your clothes from getting contaminated. We might see certain kinds of equipment that are going to be useful, and we need to clean equipment appropriately. Environment control, like following proper procedures in cleaning and disinfecting between patients or between individuals. Taking care of the linen properly, like cleaning the sheets, putting them where they need to go in the proper receptacles so they can be washed properly. And a big thing is watching for blood-borne pathogens. Do not recap needles because there's potentially a chance that you could puncture yourself. Dispose of them properly though in the sharps container. When we are doing mouth-to-mouth or CPR, if a mouthpiece is present, use that. Again, that's going to help with preventing the transfer of your own saliva into theirs and vice versa. All right, so again, these are all precautionary things, but they may not be present if you are if you come up onto a scene and somebody's in need. But using this protection helps protect you and the other individual from sometimes contamination if there's contaminants present. All right, so this brings us to then diagnosis. Diagnosis is we're going to identify and name the disease. We're going to figure out what it is. We're going to know what it is. And we are going to see that with diagnosis, there's a number of steps that have to take place. One, medical history. We want to get as much medical history from the patient as possible. Now, sometimes this is easier said than done depending on the situation. If you're working in the ER and they come in unconscious, you might not be able to take a good medical history. All right, but we also see then this leads to the physical examination. We're going to do a physical exam. We're not going to just take the patient's word for it. We're going to do a physical exam. This could lead to diagnostic tests. A certain diagnostic test may include things like MRIs or CT scans, a urine analysis, some blood work with a CBC when we look at a total blood count. All right, there's a lot of different things that we could do diagnostic test-wise. We're also going to ask the patient about their symptoms and their signs. Symptoms are problems reported by the patient. This is where the patient might complain about pain. And this is where we'd ask them, what's your pain, 0 to 10? We might use the smiley face issue of like, here's where pain's not so bad. They're smiling, where they're crying over here, it's a 10. Guys, that's subjective. We can't measure that for the patient. We have to rely on what the patient tells us. Okay, so when we look at symptoms, these are the things reported by the patient. Signs are going to be what we can actually measure or observe. All right, so a sign would be things like blood pressure, temperature, respirations, okay, heart rate. Those would all be indications or signs that something is going on. Now, skills that are used by a physician to do some of these physical exams and also test some of these signs. Auscultations, this is where you're going to listen. A lot of times we're going to use a stethoscope, and this is when they listen to your heart rate, they'll listen to your breathing, they may even listen to your stomach and your bowels for movement through there. Another one is palpitation. When we look at palpitation, this is going to be where they're going to press. Okay, and it's not going to be like a big pressure, but they're going to put pressure in certain areas, looking for, like, especially in your abdomen, they want your abdomen to be soft, not super hard. Okay, so they're going to be looking at by kind of palpating. Another one is like in your throat. Okay, when you go in and you have like a sore throat or you have swelling, they're going to palpate in here looking for those lymph nodes to see if swelling's present. Another one is percussion. Percussion is a lot of time a tapping that takes place. All right, so they'll use percussion sometimes when they're tapping on your belly. They may also use something kind of similar. I mean, it's kind of like a type of percussion when they test out your reflexes. Okay, when they use a type of reflex hammer and they do some of that. Okay, when we look at percussion. All right, but these are some of the techniques that a physician or a medical professional may use in order to help with the diagnostic process. Now here's a list of some of the diagnostic tests or procedures that are present. We can do a CBC, which is going to be a complete blood count. They can do a urine analysis, chest x-ray, electrocardiography, which is an ECG or also known as an EKG, blood glucose levels, a CT scan. We also see that they could look at your serum electrolyte levels. Those are the electrolytes found in your blood. All right, so there's a lot of different diagnostic tests that could be utilized. All right, so again, this brings us to prognosis. Prognosis is another term that is going to be what we look at for the expected outcome. What is the expected outcome for that patient based on their diagnosis? All right, so prognosis is the expected outcome. Now, does it always follow that? Not necessarily. We also, remember, can look at a disease or a progression of a disease as acute or chronic. Acute is sudden onset with normally a short duration. We can see here in this chart there are some examples of acute types of illnesses, like an upper respiratory tract infection, laceration, middle ear infection, gastroenteritis, pneumonia, even fractures would be considered acute. On the other hand, chronic are going to be insidious. They come on and then they're a gradual type of issue, and this can be long term. This would be things like arthritis, hypertension, diabetes, low back pain, heart disease, or even things like asthma. When we also look at disease, we have things like remission. Remission is a disappearance of symptoms, and we also then have exacerbation, which is a flare-up of symptoms. A lot of times with chronic diseases, we see that they might have a remission period of time where the patient actually feels better, the symptoms seem to disappear, and then they have a time of exacerbation where the symptoms are pretty intense. We also have complications. This is an onset of a second disease or a disorder. This again could come due to the type of treatment. It could be due to them also waiting too long to get treatment. Another example or another term that's important is mortality. This is the mortal or subject to death. The mortality rate of a particular disease tells us how often or what the percentage is or the chances are that death will occur. If a disease is considered lethal or fatal, that means it is deadly. This would mean the prognosis is not very good for that individual. All right, so this brings us to treatment. There's lots of different treatments available for different types of diseases. Some treatments are what we would consider holistic medicine. Holistic medicine takes into consideration the whole person, the entire person. So this is rather just not just their physical symptoms. So when we look at holistic medication or holistic treatments, they're looking at the spiritual, cognitive, social, physical, and emotional sides to that individual. They're looking at the patient as a whole. And they also look at these as all working together. They're interdependent. They're all connected, like you can see here in this picture. And in reality, there is some truth behind this. When we look at this, if the mental state of the patient is not very good, they do not feel like they want to fight or survive, treatments don't always work as well. And so we do need to look at the person as a whole, okay, not just as the disease that they come in with. So this is a type when we look at holistic medicine. Different interventions are available for treatments. Of course, medication are one of these. When we look at medications, these can be sometimes even just over-the-counter medications, like you're told to go take allergy medication or a type of painkiller or something like that, or they could be prescription. Surgery might be the option to help fix or to remedy the problems. Exercise, nutrition, physical therapy, and even education. Educating ourselves and our patients in what's going on can also help with the treatment options. Some of the things we want to look at treatment-wise or even types of interventions, we want them to be preventative. Preventative means that we're going to be giving it to help prevent the disease. A lot of times this is going to be things that are tests that are done early prevention, like mammograms. We also see like pap smears. When you get to a certain age, colonoscopies are part of that. All right, so again, it's more for preventative types of help. We see some of these are going to also be palliative. Palliative is where care is given to prevent discomfort, but there's no cure. When an individual goes on to hospice, when they know that there's nothing else we can really do to help slow down the progression of their disease, palliative care is to help keep the patient comfortable. All right, and so we see that we're just trying to help prevent that discomfort as they go through that end of life process. When we look at medical ethics, this is complicated a lot of times by technological advances. Medical ethics are the standards of conduct and moral judgments that we would see in medicine. Now, ethics in general are just those morals that individuals have, but in the medical field, it's going to also revolve around the types of treatments that we give to individuals. A lot of times this is also known as kind of a bioethics, ethics revolving around life. Now, again, these are complicated by things like technological advances. Technology is so quickly changing that a lot of times certain treatments are so new that should we use them on somebody to help, or should we wait to see how further tests go? There's a lot of different, it's difficult as we touch the core of our humanity in the sense of like from generation to generation, we have different kind of ethics or morals. Okay, what a individual who's in their 80s or 90s, how they were brought up, their morals and their kind of decision making would be different than somebody who's in their 20s. All right, and so this can be a very difficult thing to do and to make decisions that way. A lot of times because of this, it's not one individual's job to make those decisions. They are going to, in a hospital setting or in a medical setting, they're going to bring multiple individuals together and they're going to have what we call an ethics committee. This committee is going to look at the pros and cons for certain kinds of treatments, certain kinds of details about the patient, and decide what kind of things are the best for them. We also see that the patient is involved in this process as well. Another thing can also be economic concerns. Okay, we hate to say this, but money does play a role a lot of times. It shouldn't in the medical field, but sometimes it seems to, as well as individual factors like age, gender, your upbringing. In some cases, it's the patient who says, I don't want that. Even though it's something that could save their life, there may be an upbringing that they were part of, a religious group or something like that prevents them from receiving that treatment. And as medical professionals, even though we know that that could save their life, if they decline it, we have to respect that. We don't have to understand it or really know why they're doing it, but we need to respect their choices in that sense. And then also there's got to be cultural considerations. Cultural considerations have to do a lot of times when we look at culture, every culture defines health a little bit different. We also see that the type of illness or treatment available or what they find as okay might be different, again, culture to culture. And we need to respect those differences. The last thing I want to hit on that deals in this chapter is epidemiology. Now guys, epidemiology is the study of the patterns of disease. So we've looked so far that we saw that there's going to be this progression that takes place where we see what's the cause of the disease, and then what's the prognosis for patients, what's the treatment that we're going to give. But guys, we also want to look at patterns across populations, not just one individual. This is what epidemiologists do. They examine the occurrences, the incidents, how prevalent a disease is, what kind of transmission do we see? Is it airborne? Is it bloodborne? Is it sexually transmitted? Also the distribution, does it spread quickly or can it be contained very easily? Is it only affecting one group of individuals or lots of different individuals? Okay, this is what epidemiologists are going to study. Now there's different types. There's what we call endemic diseases. These are native to a local region. You'll see endemic diseases like a lot of times like Lyme disease. You're going to find it in areas where those particular ticks are present. Okay, now of course you can go visit that area and bring it back with you, but it's going to be in a particular area because the mode of transmission is through that vector of a tick. We also see epidemic diseases. They spread to many people at the same time. And then we can take it a step further where we look at pandemic diseases, where they spread to large geographic areas. It explodes. It spreads very quickly. Now, diseases nowadays can spread super quickly because of the access to travel. People can hop on a plane and travel almost anywhere they want to go. Okay, and so because of that, diseases can be transmitted very quickly from one place to the next. There are different levels of prevention when we're looking at epidemiology and trying to prevent diseases from going from endemic to epidemic to pandemic. The first is the primary. Primary is where you do not have the disease, but you're trying to prevent it. One example of this is through vaccines. All right, and so we want to prevent you from getting chickenpox, so because of that, we're going to give you the vaccine. We want to prevent you from getting the flu this season, so we want you to take the flu shot. Vaccines are an example of that. Okay, we also see that we can also be proactive a lot of times when we look at primary prevention by exercising, eating right, trying to keep a healthy type of lifestyle. Secondary type of prevention is disease detection. This is going to be those tests that are for early detection, like pap smears, your yearly physical, a mammogram, that type of thing. Tertiary is trying to prevent problems from the disease or the problem itself, like rehabilitation. All right, you already had the issue. Let's just say you already had a heart attack. Now they went in and they did what they could to fix it, and now you're going to go through cardiac rehabilitation to build that heart muscle back up to help prevent future problems, if at all possible. That's going to be the tertiary level of prevention. All right, so this particular group is just an introduction to what we're going to be looking at for pathophysiology. You'll see in following chapters, we're going to really get deeper into these different things. So the next chapter, we're going to be looking at mechanisms of diseases. Then we're going to start getting into more specifics. And when we get into those specific diseases, again, we're going to look at the majority of this stuff we talked about. What's the cause, the etiology, okay? What kind of treatments, what kind of diagnosis, what kind of diagnostic tools do we need to use? What is the prognosis with patients who are diagnosed with this problem? Okay, what kind of treatments are available? There's a lot of things we're going to be looking at through this semester. All right, if you have any questions or concerns, please let me know.